So my name is Charlotte Aldrett. I'm Director of the Centre for Progressive Policy. We're a new think tank. We just launched in March. We're here as part of our 12-month programme on looking at health and social care in England.
We are doing a deliberative forum today in partnership with Populus, where we bring members of the general public together and discuss the announced increasement of funding to the NHS.
Particularly in light of the recent government announcement for an additional injection of funding, how best do people think we should spend that money? NHS is a kind of pillar of our welfare state, and so it's an emotional issue, it's a highly kind of practical issue, how we function as a society in many instances, but also kind of the idea of kind of what binds us as a nation. And I think, particularly with the light of kind of Brexit and deep political divides that seem to be opening up, actually the NHS is something that we come back to time and again.
There's a big difference of opinion in our table. In fact, I would say the majority of us thought that it was money was being misspent. It wasn't going in the right directions or to the right services. There was a lot of wastage, which is a big concern for all of us.
From what we heard this morning as well from the people running the market research, was the money comes from the government for the NHS, then it's filtered through to another division, who then filter it through to another division, who then filter it through to the trusts, who then decide where it goes to GPs, care homes, social services. Surely there must be an easier way of filtering money down and cutting out 2 or 3 of these levels.
People can't be bothered to really work those things out because it's old now, and because they think it's old and the population's grown and there's so many people, and they just automatically jump to the conclusion that okay, it can be a mess and that's fine, that's how it would be. But actually there are a lot of things that they could fix that could save money.
I mean, it's a difficult one because we're not always going to agree on how it should be spent and where, but I think one of the topics that came up was mental health, and it's something that hasn't really been spoken about over the last few years. It's a stigma, isn't it? But I think money should be spent on that. I think it starts off with higher education. I think that should be free to those who want to study nursing and medicine, because if you want to entice people into that kind of jobs, then there's no point in them going into it. They're not going to be paid a lot, and if they're going to be stuck with student loans for the rest of their lives, there needs to be some sort of incentive for them to want to become a nurse or a doctor.
So in the afternoon, when we were talking about the different strategies, how the NHS would get those funds, we found that a lot of the views were quite negative towards those 3 options at the end of the day. As soon as we heard about how much it was going to cost, I think a lot of people were discouraged by that, and personally for me, I hated option 2. I just think, the society that we live in, we're very, like the UK, we're very lucky, we're very forward, not like other countries like America when the healthcare is so expensive. So for me to put option 2 into place, I just think that would just be going backwards, like a backward step.
My background itself is in sort of commercial finance. I've dealt with a lot of the big companies, and my contribution towards it was why not try some commercial funding as well? The big pharmaceuticals like the likes of Glaxo and AstraZeneca, they could actually contribute some of that funding to the NHS, or maybe reduce some of it, as a result of selling them the pharmaceutical products. At least that way, that would take some of the burden off our country.
I mean, it was really good. We had a complete mixture of opinions in the group, so conflicting ideas, which sparked some healthy debate. I think it was quite clear that everybody wanted it to remain free, or as cheap and accessible as possible. I think that we could have probably explored the route of how technology can play a bigger part into efficiencies. So that was a big thing that came through, efficiencies in the NHS as it is currently.
I think it all boils down to, at the end of the day, actually it all boils down to whether, everybody can have all their opinions, but whether actually the gods above, i.e. the government, will actually listen to what people are saying and take it on board. My personal opinion is, it doesn't matter how many market researches they've done and what they are told, they don't actually listen.
I think 2 main things that have struck out for me from today is the education part of it. A lot of people aren't educated and don't know how to lead a healthy lifestyle, and it kind of education branches off to also doctors and nurses who aren't getting paid enough, there's not enough bursaries to get into the NHS and health and social care. There needs to be more funding from the government. And I know it's really hard because where is that money going to come from? And it's caring for those vulnerable and elderly people that I really think is the most important for the NHS going forward.